Okay, so you've been watching those magical home birth videos, twinkle lights, birth pools, moms just breathing their babies out like it's a yoga class.
Yeah, like, oh, I just casually had a baby while meditating and drinking herbal tea. Meanwhile, you're thinking, wait, am I supposed to do that in a hospital?
Exactly. You're probably wondering, if I'm not in a birth tub surrounded by fairy lights, am I doomed to a birth full of needles and monitors? Spoiler alert, you're not.
Yeah, the good news is you can have a calm, unmedicated birth in a hospital and you don't even need a string of fairy lights to pull it off.
In this video, we're going to break down exactly how you can stay in control of your birth experience, navigate the hospital environment, and feel confident in your decision to go unmedicated while still getting the support you need. Let's get started. So why would you want to choose an unmedicated birth in the first place? There are some amazing benefits that research has shown to make a real difference. For example, one study found that epidurals can increase the second stage of labor, that's pushing, by about 42 minutes on average. That means that by avoiding an epidural, your labor might be shorter and more efficient. Another important benefit is mobility. Without medication, you're free to move around during labor, which can actually help speed up your labor and lower your chances of needing interventions like Pitocin or a C-section. Research shows that movement during labor is key in helping your body progress naturally, and unmedicated moms are often less likely to need a C-section, especially important when around 32% of births in the US end in C-sections. By going unmedicated, you're also reducing your risk of needing forceps or vacuum-assisted delivery. Both of these interventions can have their own risks, so avoiding them is a huge plus. Another benefit for your baby is that babies born to moms who go unmedicated often have higher APGAR scores, meaning they tend to be more alert and responsive at birth.
Plus that immediate connection between you and your baby without the grogginess from medication, it can be really powerful.
Exactly. And I think that's what a lot of moms are looking for, feeling a little more in control and being fully present for every moment of birth. Recovery is often quicker too. Moms who avoid epidurals tend to get up, moving around sooner after birth, which is really important for your physical recovery and also for bonding with your baby. And even though we're talking about unmedicated birth, there is still a benefit of being in a hospital. Hospitals, they give you access to medical professionals and advanced care in case anything unexpected happens. You have the safety net of fetal monitoring and, if necessary, access to NICU services. But by choosing an unmedicated birth, you can still avoid many interventions that can actually slow your recovery and affect your postpartum experience.
It's really about balancing the benefits of both worlds, unmedicated birth and the security of hospital care.
Now, if you're sold on having an unmedicated birth in the hospital, we have got a free training. It's called 4 Secrets to Unmedicated Hospital Birth, and it goes deeper than this video and will help you feel even more prepared and confident.
In it, we cover practical tips on how to avoid the epidural, get your partner on board to support you, and advocate for yourself to avoid unnecessary interventions. It's a must watch.
The link is in the description below, so make sure to sign up today. And don't forget to like this video and subscribe for more birth tips for couples. Okay, let's talk about the reality of giving birth in a hospital. While hospitals are designed to provide medical care, they're often a little more geared towards standard procedures that can sometimes conflict with an unmedicated birth plan. I've seen this firsthand in supporting my doula clients through hospital births. It's not uncommon for hospital staff to suggest interventions like breaking your water or Pitocin to speed things up, even when mom is actually progressing just fine on her own. I've had clients who were ready to give up on their unmedicated plans because they felt so pressured by doctors or nurses who were concerned about timelines and hospital policies. But when we stood firm and advocated for her wishes, I've seen those moms go on to have incredible unmedicated births that were completely within their goals. But the key is knowing how to navigate those conversations. So for example, one client I worked with, she was repeatedly encouraged to stay in bed for continuous monitoring. But we knew that getting her moving was critical to her progressing. And so by politely insisting that we use intermittent monitoring instead, she was able to walk and squat and use a birthing ball, and her labor progressed smoothly without the need for any interventions. So it's important for you to understand that the hospital staff, they aren't trying to push you into something harmful,
right,
but their approach is often more focused on protocols rather than your unique birth plan. And so that's why it's so important to advocate for what you want and know your options ahead of time.
In our birth class, we really emphasize the importance of partners being involved in that process. As a partner, your role is to stay calm and understand that birth plan to be able to ask questions when needed. Sometimes all it takes is asking, do we really need this intervention right now? Or what are our other options? And that can shift the conversation and give mom the space to stick stick with her plan.
Exactly. The more informed and confident you both are going in, the easier it will be to stick to your plan and have the hospital staff on your side. Okay, now let's talk about the elephant in the room, which is managing your pain naturally during labor. I know that the thought of going unmedicated in a hospital might feel really overwhelming, but there actually are so many effective ways to cope with labor pain without medication, and they're all things that you can do even in a hospital setting. One of the most powerful tools is your breath. So deep, focused breathing, it can help you stay calm and centered even during intense contractions. So what I do with my clients is I have them breathe in through their nose for a count of 4 and then out through their mouth for a count of 6. It sounds really simple, but it actually keeps you in control and helps regulate your pain response. Another really important strategy is creating a calm environment in the hospital. So in the hospital, your provider, they may want to walk in and turn on the lights and talk loudly or insist on regular cervical checks, but all of these things can make it really hard to get into what I like to call the labor zone. This is a place of deep inward focus where you're able to stay confident and calm as your labor progresses.
Partners, you can help create this peaceful environment, dimming the lights, encouraging providers to be quiet when they come in, playing calming music, or even just bringing personal items like a pillow from home can make the hospital room feel less clinical and more like your own space. It's these little things that really make a huge difference in how she feels during labor.
Exactly. Another technique I love is using water for pain relief, like a warm shower or even a birthing tub if your hospital has one. Warm water can be incredibly soothing during labor. And of course, having a supportive partner or a doula apply counter pressure or massage during contractions can really help you cope with the intensity of labor. Remember, your mindset plays a huge role too. Approaching labor with the belief that your body is capable and designed to do this can be incredibly empowering. I've seen women transform from feeling really nervous to completely in control just by shifting their mindset and trusting in the process. One of the biggest fears I hear from moms is that they won't be respected by the hospital staff, especially when they're trying to stick to an unmedicated birth plan. And honestly, it's understandable. Hospitals, they have their own routines, and sometimes those don't totally align with what you want for your birth. But here's the thing, you deserve to be heard. You are the expert on your body, and it's important to remember that. One of the best ways to set yourself up for success is by having clear, open conversations with your provider before labor starts. Let them know your preferences ahead of time so it's not all happening in the heat of the moment. And when you're in labor, don't be afraid to ask questions. If something feels off or you feel pressured, it's okay to ask, can I have a moment to think about this? Or is this really necessary right now? You don't have to say yes to everything immediately.
Yeah, just taking that pause to ask a question can change the whole tone of the conversation. And from what we've seen, hospital staff are usually very open to giving you more time if you just ask for it. It shows them that you're informed and you want to be an active part of the process.
Exactly. And when you ask questions like, what are the risks and benefits of this intervention? Or are there any other options? It reminds everyone that you're serious about your birth plan. Staying calm and confident goes a long way in making sure you're respected during labor.
And that's really where preparation comes in. The more prepared you are, the easier it is to have these conversations without feeling confrontational and to stay in control of your birth experience.
In the end, it's all about balancing confidence and flexibility. You want to stay committed to your plan, but you also need to know when to adapt it if necessary. And you absolutely can have the unmedicated birth you want, even in a hospital setting. Preparation is key, and we are here to help you with that.
That's right. If you're looking for more guidance, don't forget about our free training, 4 Secrets to Unmedicated Hospital Birth. In that class, we dive deeper into exactly how you can stick to your birth plan, advocate for yourself, feel confident through the entire process, and get your partner involved.
The link to sign up is in the description below, and we've packed it with practical tips and strategies to help you feel fully prepared. So if you haven't already, make sure to check that out. And don't forget to like this video and subscribe for more tips on pregnancy, birth, and all things parenthood.
Yeah, we've got a lot of great content coming your way, so hit that subscribe button and join our community. We're so happy to have you here and support you on this journey.